Okay, in this video, we're gonna be administering ophthalmic medication. We're gonna pretend this is my eye medication. Okay, so we're gonna make sure we do our six rights administration. Make sure we do our 3 safety checks on the medication. Make sure everything is matched and everything. We're gonna, make sure we check for patient allergies, any labs, anything, any contradictions on taking a medication. We're gonna make sure we do all those steps, and then we're gonna jump into giving the eye medication. So I'm gonna wash my hands and I'm going to put on gloves. Let me get a towel. Wash my hands and put on gloves. Then I'm gonna get a towel and I'm gonna wet the towel, and I'm going to clean the patient's eyes, both sides of the patient's eyes, making sure I get all crust and things like that, going inward to outward on both sides, going inward to outward. And also, if I want to use my little minion, going inward to outward, inward to outward. Okay, and then then I'm going to change my gloves. Sorry. Then I'm going to change my gloves. Well, I'm going to take my gloves off. I'm going to perform hand hygiene again, and I'm going to put on more gloves. Okay, I'm going to get my eye medication, and I want to make sure that when I get my eye medication, I want to check the expiration on it to make sure that it's still good. Okay, now once I get my eye medication, we're going to first start with a liquid. If you have liquid eye medication, on the order, it's going to tell you how many drops that you're going to put per eye. So you want to pull down the conjunctival sac. You want to do this to the eye. You want to pull it down here. Okay, you're going to have the patient hold their head back. I can do it, on him. You're going to hold it down, and then you're going to place the amount of eye drops. So say it's 2, 1, 2, and then you're going to let it go back, and then you want to press on the lacrimal gland on the side, which is here. And that's for if you have any medications that work systemically, which means that with it could go down. It could go down into your sinuses and in your bloodstream, and it could affect the medication could be used for other things, like the example, Timolol is a beta blocker. So, I know it's an eye medication. If it gets down into your bloodstream, it can lower your blood pressure and things like that, because it's a beta blocker. So you wanna hold there when you're doing the medication, so it doesn't get into your bloodstream. Okay, so that's with the liquid eye medication. If you're using a cream, say you have a cream, you get the cream. You wanna do the same thing. Pull the eye down, and you want to put a line of the cream from inward to outward, and then you close it back. Okay, you want to have your patient to close their eyes gently to make sure that everything gets in there. Okay, and once you do that, you want to have allow the patient to sit up. They can pat their eyes real gently with the tissue, things like that. You want to make sure you document the drops or the cream that you put in the eye. Document any adverse effects. You want to check back in 30 minutes to make sure everything's okay. That's with your evaluation. Then you want to document everything, the patient's response, any abnormal findings that you might have had. Okay, and that concludes the eye medication.